Let's get real. If you're dealing with tinnitus, there's probably one question eating at you. Is this ringing ever going to stop, or am I stuck with this for life? You've probably heard the classic line before, you're just going to have to learn to live with it. And honestly, I hate that answer, because some people's tinnitus does go away completely. Others, it fades so much that they barely notice it. And yes, some folks are still stuck in the noise, desperate for a solution. I'm Dr. Layne Garrett, and I've been treating tinnitus patients in Utah for over 20 years. And this is the question I get asked most of the time, usually within the first 5 minutes of meeting a patient. The truth? It's not one size fits all. Today, I'm going to walk you through what the research actually says, the three possible outcomes you might experience, and what determines whether you'll habituate naturally or need help getting there. When I meet with a new patient, I explain there are three different outcomes, and understanding them changes everything about what we aim for with tinnitus treatment. Number one is complete resolution. Yes, sometimes tinnitus does go away completely. No more phantom ringing, nothing. It happens most often when the cause is something treatable like earwax or ear infections, certain medications, or problems with your jaw. I had one patient, her tinnitus showed up after an ear infection. When we got that cleared up, the tinnitus was gone within 2 weeks. Another had it from a new blood pressure medication. We worked with his doctor to switch it, and the tinnitus vanished. Research on sudden hearing loss found that when hearing loss was mild to moderate, 2/3 of patients had complete resolution within 3 months of their tinnitus. And military conscripts with acute noise trauma showed 73% recovery. Yes, so total recovery is possible, but it's usually tied to an acute, fixable trigger. Now, what about when the cause isn't something we can just reverse? This is far more common. Your brain still hears the sound technically, but it tunes it out like background noise, kind of like the hum of your fridge. You just don't notice it very often. Research says 80 to 90% of people will habituate naturally to their tinnitus. Their brain just filters it out and says, not important. The sound is still there, but functionally, it doesn't matter. Then there's the third category, people who still hear it but aren't bothered by it anymore. You still hear the tinnitus. You notice it sometimes, but it no longer runs your life. The emotional reaction is what changes here. With proper treatment, we can help 75 to 90% of people who don't habituate naturally get to the point where it doesn't bother them anymore. A recent real-world study on bimodal neuromodulation showed over 91% of users got meaningful relief. So even if it doesn't completely vanish, relief is absolutely possible. Knowing that these three outcomes are possible, the next question is, which one of these applies to you? Well, your outcome depends on three big things. The cause makes all the difference. If your tinnitus is from something reversible like earwax or ear infections, you have a strong shot at full resolution. But what if it's tied to permanent hearing changes like noise exposure or aging? That's a little different. Data shows patients with mild hearing loss are 3 times more likely to not be bothered by their tinnitus than those with more severe hearing loss. And timing matters. If your tinnitus started recently, like within the last 3 months, your odds of natural improvement are way higher. Once it hits 6 months and beyond without intervention, spontaneous recovery becomes much less likely. Now, even when we know the physical cause of the tinnitus, there's another critical piece of the puzzle, your brain's response. See, tinnitus isn't just an ear thing, it's a brain thing. Harvard research shows people with chronic tinnitus have increased activity in their brainstem. The tinnitus is your brain reacting to reduced auditory input from the ear. When I evaluate someone, I need to assess both the auditory component and the emotional response of their brain to the tinnitus. Some people have loud tinnitus and they just don't care. Other people have mild tinnitus and they can't sleep and it's wrecking their life. Why is that? Well, it's their limbic system, the part of their brain that tags things as threats. If your brain has categorized the tinnitus as a dangerous sound, you're going to be stuck in a stress response cycle. That's what prevents natural habituation from happening in the first place. Now, assessing that emotional response is critical, but I also need to find out what your brain is actually reacting to, because there's almost always an underlying cause. Interestingly, standard hearing tests might look completely normal and someone's experiencing tinnitus. In my clinic, we go further than the basic hearing test. We do otoacoustic emissions to check how well those little inner ear hair cells are working, the microphones of your ear. We test extended high frequencies that most places don't measure, and these tests almost always reveal the hearing changes driving your tinnitus, even when people have been told before that their hearing was fine. So when someone comes to me saying, no one can find a cause for my tinnitus, my first thought is, did anyone actually do comprehensive testing? Did they test those high frequencies? Did they do otoacoustic emissions? Or did they just run a standard audiogram and call it a day? Because when we use proper evaluation protocols, we will find underlying causes in the vast majority of cases. Now remember, I mentioned that 80 to 90% of people habituate naturally. That leaves 10 to 20% of people who don't, and understanding why that happens is also really important. It's not because they're weak or dramatic, it's because their brain is stuck in that anxiety loop. Here's what happens. You hear their tinnitus, your brain thinks it's a threat. That creates stress. The stress makes the tinnitus feel louder and more intrusive, which creates more anxiety. Round and around and around you go. This isn't about willpower, it's neurology. Every week I see patients stuck in this exact cycle. Every time they hear the tinnitus, their limbic system says it's a threat, which triggers their stress. The stress makes them more aware of their tinnitus, which triggers more anxiety and stress. These patients aren't doing anything wrong. Their nervous system is genuinely responding to the tinnitus as if it's dangerous. Breaking that cycle requires more than just time. It requires intervention. That's why cognitive behavioral therapy techniques work for tinnitus. We're not just teaching relaxation. We're actually helping to rewire the brain's response to the tinnitus. And here's what I see. When you combine cognitive behavioral therapy with other approaches like properly fit hearing aids or bimodal neuromodulation for more severe cases, we see that 75 to 90% success rate. The research backs this up, but what matters more is that I've watched that happen hundreds of times with patients who went from severe distress to functioning normally. And here's something that just gets me fired up. Every week I see patients who are told there's nothing that they can do for their tinnitus, that they're just going to have to live with it, and that's just not true. Clinical trials of linear bimodal neuromodulation alone show about 78% of patients get meaningful relief. Properly fitted hearing aids show about a 75% success rate for tinnitus related to hearing loss. Cognitive behavioral therapy consistently demonstrates effectiveness. And here's what really matters. A 2025 real-world study from a comprehensive tinnitus clinic showed that when you combine these three approaches, linear for appropriate candidates, hearing aids when there's hearing loss, and cognitive behavioral therapy techniques, over 91% of patients got meaningful relief in the first 12 weeks. That's the power of comprehensive treatment versus just one intervention. Comprehensive treatment isn't handing someone a sound app and saying, you're going to have to live with it. In my clinic, it's proper evaluation using specialized testing. It's identifying what's actually driving the distress and not just guessing. And it's creating an individualized treatment plan. And it's also about tracking your progress objectively. We actually use heart rate variability monitoring to see how your nervous system is responding to treatment. That level of care makes the difference between learn to live with it and actually getting your life back. And expectations matter. If you're chasing full elimination, you might reject the very tools that could help. But if you shift the goal to function again and feeling at peace, that's where we win. Ask yourself, if the sound was still technically there, but you didn't notice it or care, would that be enough? For most tinnitus patients, the answer is yes. The goal isn't about eliminating the perception of tinnitus, it's about eliminating the distress. So, can tinnitus fully go away? Sometimes, yes. But most of the time, the goal is getting you to the point where it doesn't bother you anymore. If it's from a treatable cause, there's a strong chance of resolution. If it's from permanent hearing changes, we can still reduce the distress dramatically. That old advice to just live with it isn't wrong. Habituation is real and it does work, but it's also not complete. Because for 10 to 20% of people, it's not just about time, it's about proper treatment. Now, I want to hear from you. Has your tinnitus changed over time? Have you noticed any improvement? Or does it still feel like it's just running the show? Drop a comment below. And if you'd like to learn more about evidence-based tinnitus treatment, I've put together a free online learning center with comprehensive information about what actually works. The link is in the description. And if you're here in Northern Utah and want a full tinnitus evaluation, not a quick dismissal or empty promises, but proper assessment with specialized testing and realistic treatment options, you can schedule an appointment online. That link is in the description as well. Thanks for watching. I'll see you in the next video.